Hello, Professor. Today I will introduce my project, Analysis and Visualization of Global COVID-19 Data. This project explores the impact of five key factors like vaccination and outbreak control, the impact of government policies on the spread of outbreaks, the effect of hospitalization rates and ICU resources on mortality, demographic structure and the epidemic severity, and last is the COVID-19 detection strategies and positive rates. For the first part, let's look at the data processing and management part. The COVID-19 dataset comes from our world in data, covering indicators, vulnerability coverage, government policy responses, and other variables across multiple countries and regions. Due to the diversity of data sources, dataset contains many missing values and outliers. So data cleaning and management was the first step in the project. First, we handle the missing value and duplicates. We use forward and backward filling to maintain data continuity, and for smoothed variables, we use the row mean imputation to reduce data fluctuations. Second is handling outliers. We use this score method to point over three standard deviations are labeled as potential outliers and use IQR to solve this problem. The third one is the data transformation. To optimize data distribution, we applied logarithmic transformation, standardization, and normalization. Additionally, for categorical variables like country codes, continents, we use a one-hot encoding and a label encoding to convert them into numerical formats for further analysis. And the last one is the data segmentation. Based on different research topics, we divided the dataset into 5 subsets, each focusing on vaccination, government policies, healthcare resources, demographic structure, and testing strategies here for 5 subsets here. And next, we do the analysis. First is the frequency distribution analysis. This graph shows the frequency of some variables here, and I make a histogram here. This chart shows that the relationship between vaccination rates and the new cases. We see that as the vaccination rates increase, the number of new cases decreased, especially in countries with high vaccination rates. However, some countries still have high case numbers despite high vaccination rates, possibly due to virus mutation, policy adjustments, and the resumption of social activities. Like this graph, this chart shows the relationship between booster shot and the new deaths. As booster vaccination rates increase, mortality further declines, suggesting that boosters enhance immune protection and reduce severe outcomes from breakthrough infections. However, some countries still experience high mortality despite booster vaccination, possibly due to accelerate booster campaigns during severe outbreaks. The first part is impact of government policies. These two graphs show that the relationship between the stringency index and the new cases and the deaths. The overall trend indicates that stricter policies lead to fewer cases. However, some countries still experience high case numbers despite high stringency indexes, possibly due to virus mutation, testing rates, and policy lag effects. For this chart, this heat map shows the correlation between the stringency index and variables such as new cases and deaths. The stringency index is negatively correlated with new cases and deaths, indicating that government measures are effective in controlling the pandemic in the long term. However, the weak correlations suggest that the actual effectiveness of policies depends on factors like public behavior, vaccination, and virus mutation. Okay, let's go to the third part. I will show this graph. This chart shows the relationship between ICU patient numbers and the new deaths over time. Countries with lower ICU patient numbers tend to have lower new deaths. In regions with strained ICU resources, mortality increases significantly, indicating the healthcare system capability plays a critical role in pandemic control. And I will show this graph shows the relationship between the preparation of the elderly population and the COVID-19 mortality. Countries with higher elderly populations tend to have higher mortality rates. However, the weak correlation suggests that mortality is also influenced by healthcare resources and underlying diseases. And this this box plots compare COVID-19 mortality between populations with high and low prevalence of diabetes and cardiovascular diseases. Mortality is significantly higher among those with these underlying conditions, indicating that there are important factors affecting COVID-19. And this box plot compares the distribution of possibility rates across countries with different testing intensities. Countries with higher testing intensities have lower and more stable positivity rates, indicating that large-scale testing helps control the pandemic. Okay, through this study, we found that vaccination, government policies, healthcare resources, demographic structure, and testing strategies all significantly impact the spread and the mortality of COVID-19. Global experience shows that comprehensive prevention and control measures are more effective than single strategies. In the future, data sharing and international cooperation should be strengthened to jointly address public health challenges. Thank you for watching. I hope this video helps you better understand the process or the results of COVID-19 data analysis I made. If you have any questions or suggestions, please leave me a comment below. Thank you very much.